I initially visited Thailand to do medical tourism and to get some treatments that just aren't available or affordable even in America. And the first time out here, I went to some regenerative clinics, one of them called Zen Clinic, and I definitely can recommend that place. Just watch that video to check out what they all do. But this time around, I just went to a regular hospital. I wanted to go to an international hospital to get some updates on either blood work. I wanted an update on my thyroid ultrasound because it's been a few years since I did that. So what I did was I visited first to do dentist work because I had a chipped tooth. I just made a video about it, so you can watch that there about if you are needing dentistry done in Thailand. But while I was there, they have all these other departments. So I asked to schedule an ultrasound and to speak with a rheumatologist. Just like in America, you have to get an order for the ultrasound. So they first had me see a doctor, a general doctor. He asked a few preliminary questions about what my symptoms were, why I think I need this, yada yada. After I showed him my previous images of my ultrasound and he saw how long it's been, he's had no problem ordering that for me. So just the cost of the doctor consultation and the ultrasound, I believe it was like 2,800 baht, and the doctor himself was 500 baht. So maybe like $15 to see the doctor, and then I'd have to do the math on the 2,800 amount, but a lot cheaper than America. I just went to my general doctor in December last time, and he charged my insurance over $200. And he didn't really do shit other than order a couple blood tests, which he didn't even do. But anyway, I digress. I'll go back to my other things. So he ordered the ultrasound. I was trying to get it scheduled on the same date as when I'd come back to see the rheumatologist because they weren't able to do it that day, the first day I was there. So they scheduled me for a 10 o'clock appointment and an 11 o'clock appointment. I ended up getting there at 9:30, a little early. They sent me to the fourth floor, which is where the rheumatologist was from. And then they said, you'll have to come back at 11. No one's here yet. It's election day here. And even my ultrasound, that one I think was supposed to be at 10 first, but they moved that one back to 11. And then the other rheumatologist to 11:50. So I don't know if there's just miscommunication or just because of the election threw things off, but I had a lot of waiting to do. So I walked around, got a coffee, an expensive coffee that was double the price of normal, but killed some time, came back. I first saw the rheumatologist before the ultrasound, which I thought was backwards anyway. It's like, wouldn't you want to know like an updated status of what that's looking like? But I know he's not specifically the one that normally does the ultrasound radiology stuff. That's more the endocrinologist traditionally, but I haven't had good luck with those, so I wanted to see a rheumatologist to maybe test extra further things, because with my autoimmune condition, it's very common to have comorbidities. And I've already been to a rheumatologist in America, and he was the one that actually helped me find some spine diseases I have, and help diagnose a couple extra things that just other doctors weren't looking at. So I came to him, and unfortunately, immediately when I walked in the office, I could tell by his expression looking me up and down, he's like, "You're the patient?" And I'm like, "Yeah." But I could just tell he was just shocked about how young I look. I look relatively skinny and in pretty decent shape because for the past 5 years, have changed my diet I'm eating a lot healthier foods, and I'm restricting like the gluten, the sugar. So it's mostly just cutting out breads and sugar that made me skinny, just truth be told. But he wanted to just kind of like have me like, so why are you here to see me? Like, what are your symptoms? So I start listing, like some of the main symptoms I'm dealing with, which is a lot of like the primary one is still my bloody stools. I keep getting blood in my stool. Some of it's from hemorrhoids that keep coming back. And I've tried to explain to him I'm on stool softeners. I've tried going vegetarian for over a year. I still eat consciously about keeping my stool soft, and I'm never constipated. So why these things keep coming back, that's what I'm trying to figure out here. But I have joint pain and random joint inflammation in my wrists and ankles, and my back and hips still pop, and it's just like, man, I still struggle a lot. Weekly, daily, even daily. But he was asking, so how often do you feel this way, and blah, blah, blah. It's like, I have pictures I can show you. So I showed him one picture. But unfortunately, he just was not looking very deeply at all the tests that I've already taken. I showed him an anti-nuclear antibody test that was positive, and he just said, you have nothing to worry about. You're too young. Enjoy life. Don't be so stressed. It's all in my head. Shit, I don't want to hear, because I've heard it 1,000 times already. I've been to so many other doctors that say, oh, you're too young to have these problems. You look too healthy to have these problems. And it's like, yeah, well, do the fucking blood work and you'll see I kind of have some problems on the inside. There's a reason I feel like shit. There's a reason I'm a little stressed. But I'm like, I know, stress not good. It's not like I'm trying to focus on these things, but it was almost more like he was telling me not to look into these things, that I'm worrying too much. I'm like, I'm pretty sure anybody would be worried if they're bleeding out their ass more days in the year than not. Like, that's a problem. Fortunately, I'm finally talking to more of a functional medicine doctor as like a consultation right now. And it's like, dude, it's almost criminal what some of these doctors do and dismiss you. And, you know, they shouldn't dismiss you. They should look deeper into what's causing it, especially when you're showing them bloody stool photos or my joints that are swollen and shit. Those are symptoms that are happening. So without even telling, like, I didn't tell him I had trouble falling asleep or anything. I don't even think I told him I felt fatigue yet. But immediately he was just like, I'm not going to order any tests further. I'm just going to give you this sleeping pill. It's not addictive or anything, but I want you to take it and just want you to be happy. Be happy. And I'm like, that's why I came to Thailand, because I'm trying to be happier. I'm trying to live my life a little bit and enjoy a few things, but it's really difficult to enjoy things when I'm bleeding out my ass and dealing with back pain and joint pain and shit that I just cannot get to go away despite changing my diet. So the only advice he gave me was to eat more vegetables and be happy. Okay, doc. Been there, done that, tried it. Anyway, so I do my ultrasound after that. Good news there, wasn't too much of a change, allegedly. That's their story. I never saw a picture or anything, but you know, for all I know, they could have just wrote what my previous measurements were and wrote it on the new paper. I don't even know. But I mean, ultimately, you can't see. I don't have a huge goiter or anything. And most of the time, like most people say, if it is cancerous, it takes so long to spread, or it's like I'll probably die before it actually kills me. So I guess I could be grateful about that. So I went to the general doctor after the ultrasound to follow up with him about it, and I saw the rheumatologist, and he was asking, so what all happened with him? What did he say? I said, he basically told me to eat more vegetables. He was like, really? You didn't do any other tests? I'm like, no. I said, I tried to show him some previous test results, but he didn't really look at them. But I said, would you look at them? I said, right here, and I showed him my anti-nuclear antibody test, which was positive, and a few other things. And he's like, so what do you expect, you might have? I said, well, that's what I'm trying to find the right person to do more tests, to dive deeper into it, because I said I'm keeping my hormones in the range that they're supposed to be as much as I can with my other medicine. And that's supposed to take away all the other symptoms, but it's not. And so that's why I'm here, trying to find out what other tests should I do and who do I need to speak with to do them. And he kind of smiles at me and says, a rheumatologist. And he's like, well, what do you expect you have, maybe? And I said, well, I know it's very common to have, I think it's called Sjogren's syndrome or disease. It's common with Hashimoto's. And it gives you dry mouth, dry eyes, joint inflammation in the wrist and ankles and other areas, which could overlap with a whole bunch of other diseases, right? So it's really hard to diagnose. And a lot of times they have to take a tissue sample in your mouth. None of that's ever been done for me. And the doctor I was speaking with also happened to have that same thing or similar, I think, because he was like, yeah, I also have dry mouth, dry eyes, and my wrists, and my bones, my fingers. I feel like I have arthritis, is what it feels like. But he even admitted, he's like, yeah, you need to see a rheumatologist. But he's like, I recommend going to a medical school, the one in Bangkok, because at least at the schools they're doing more research-based testing and will probably follow up with you better. Which was just overall disappointing that, in the same hospital, the same roof, that I'm getting two different recommendations, and one that's supposed to be the expert on rheumatology, and he was also an immunologist for like allergies and for immune problems. That's the professional they had there, which was so dismissive, didn't want to do diddly squat for testing, and just judged me based off of my appearance. So, needless to say, I won't be going back there. And I'll be doing more research before I spend a whole bunch of money going to a place for them to just tell me to eat more vegetables. Unacceptable. And so they send you downstairs after to pay the bill after all that crap. And I wasn't even going to take the medicine because it's like I don't have too much trouble falling asleep. But of course they charge me. And then they show me like the itemized list of what it's all for, and then it shows the medicine on there. I'm like, whoa, I thought I would be paying that when I go to the pharmacist. But the pharmacist was just right next to the billing station, which was new to me. And it's like, I was trying to ask my wife at the time, like, can I just refund this? I don't really want it. And she's like, no, there's no refunds here. They already billed you and you paid for it. Again, the medicine was only 300 baht also, but yeah, so from the extra medicine I won't be using, for the extra x-ray I did, another 300 baht, almost 1,000 baht total extra of shit I didn't even need. All of that aside, that day I spent almost 5,000 baht to see the rheumatologist. The ultrasound itself was only 2,800 baht, so I thought that was reasonable. But yeah, that's my experience with going to a doctor in Thailand. Unfortunately, not too much different than America, other than the cost slightly cheaper, but expensive in Thailand terms. So maybe I'll look into the medical school next in Bangkok. Like I said, I'm in communication with someone who's a functional medicine doctor that is willing to do a free consultation for me at first. So at least I can maybe figure out exactly what tests I should be looking for next, or things in my diet to try to adjust. I mean, I'm pretty much just eating chicken and rice most days. And like I said, no breads, gluten. I don't even do dairy that much, but I've done the elimination diet multiple times before and have kind of tested a few things. I don't think I'm very reactive to dairy. I still don't eat it or drink it ever, hardly at all, but when I have ice cream occasionally, it doesn't really bother me. No other symptoms. So I don't know. I don't know what it is. Sometimes I'm not convinced it's a food related thing, although I know food probably compounds the issue. Like if I'm eating bullshit, I know like bad food will make you feel worse regardless if you're healthy or not healthy. So but it's hard for me to just tell if I'm reacting to the food or if it's just my immune system attacking itself or not getting enough hormone or absorbing my nutrients correctly. Those are other areas I need to delve into deeper. So anyway, that's my experience going to an international hospital in Thailand. Check out that other dentist video I mentioned. That was a better experience. And yeah, I'll keep you posted and updated on my health journey. I'm not sure what channel this is going on, but I'm uploading most of my health things on my Health Disciples channel, which I'll link below or in the cards. So go follow over there to be healthy. See you on the next one.